Hello, everyone. Welcome back to the Integrative Health Podcast with Dr. Jen. So today we have Dr. Elle Campbell. She has been board certified in family medicine for over 30 years. That's amazing. And she also holds certifications from the American Board of Integrative Medicine. She trained at the Medical College of Georgia in Bale Doneen Method and through the Cardiometabolic Program at the Institute for Functional Medicine. She's an expert in cardiovascular risk reduction. As a solo physician for 18 years, she has specialty interests in interdisciplinary collaboration, bioidentical hormone replacement, which is great, reversing chronic diseases, natural treatments for high blood pressure, and oral systemic connections, which is so cool to talk about. She has been an advisory board member to the International College of Integrative Medicine and the American Academy for Oral and Systemic Health. She's an author, a mentor, and an international speaker who enjoys live theater, gardening, healthy cooking, hiking, travel, and play time with her husband, 3 adult daughters, and 200-pound dogs. So welcome, Dr. Campbell. I'm so excited to have you. We've been meaning to do this forever, I feel like.
Yeah, I know. Thank you. Thank you for inviting me. I'm thrilled to be here and share some of my latest explorations in preventive wellness with your audience.
Yes, and we have some amazing things to talk about. And as I am, Dr. Campbell is an integrative family physician, which is so important because she is boots on the ground doing the work at her brick and mortar office. And she also decided to write a book. So out of all the conditions you see in your office, why did you choose to write a book about blood pressure?
Yeah, thanks. So I'm so excited. It's coming out on Amazon November 14th. So the blood pressure blueprint, I'm thrilled that it's finally out. This has been a 5-year labor before I finally delivered it. So I'm so happy that it's out. So I actually want to tell you a story, a patient story that led me down this path. I'm a family physician. I love taking care of families. And Cheryl came to see me when she was 42, wanting to have a baby. And the doctor's telling her that she was infertile and couldn't. And I said, I don't know, but maybe. So we worked together and she successfully had a little baby boy.
Aww.
And so that was her second child. And I was thrilled to help her along that path. And then she invited her mother to see me because Cheryl said, well, if you're good with hormones for fertility, you must be good with hormones for my mother, who could use a little hormone help, I think. So I started seeing Dee, and Dee had high blood pressure, and we treated her for that. And Dee had high cholesterol, and we treated her for that. But she also needed a little bioidentical hormone help to keep up with her much younger boyfriend. And so she was one of my very favorite patients. She was spunky and alive and a line dancer, and she took care of the family business. And then one day Cheryl called me and said, Mama didn't show up for work today. And she raced over to the house and found her mother alive, but barely breathing, collapsed on the floor next to her computer. And Dee had had a massive stroke, paralyzed on one side. And she went to the stroke center hospital, which we have near us. Too much time had elapsed for her to get the miracle clot busting drugs. So after they stabilized her blood pressure and got her over to the rehab unit, she had this horrible complication called hemorrhagic transformation. And that's what happens when the blood vessels from the stroke are so fragile and friable that they burst. So she developed a brain hemorrhage and she died. And I felt like I had been punched in the gut because she was my patient. She depended on me to keep her strong and healthy. And I thought I managed her blood pressure and I thought I managed her high cholesterol. I followed the best evidence-based guidelines in the country, and she had an event anyhow. So I felt like I had missed something. I missed something in her blood pressure, or I missed something in her history, or I missed something. And at that time, I didn't know what it was. I spent the next 3 years going to every single conference I could, because after all, cardiovascular disease, heart attacks, and stroke are the #1 killer in our country. And if I, as a family practitioner, am not great at this, at managing this, then I'm going to miss the #1 killer for my patient population. So make a very long story short, I discovered the missing piece. And the missing piece for Dee was that she had a toothache and she had an infected root canal tooth and was waiting for the dentist to pull it out. But when those mouth bacteria get into the bloodstream, they can trigger an inflammatory cascade that sets off a stroke. And so I didn't know that she had a toothache, and I didn't know that she was about to see the dentist. And had I known, we might have been either more aggressive about getting her in sooner or double checking her blood pressure to make sure it was absolutely at target, and or working on other root causes to make sure that they were under control so that she could handle this additional burden of the root canal infection. So after 3 years of studying this and implementing these root cause resolution strategies for managing cardiovascular disease, I considered myself an expert because for 4 years, I had 0 heart attacks or strokes in my practice. And I felt like that was a mission that I wanted to share with everybody. So I started Googling to see, what about root canal infections do people Google? What do they care about with their teeth? What do they care about with their mouth? And nobody cares about this. Nobody cares about oral and systemic connections, but they do care about their blood pressure. So I decided to write a book about blood pressure that links the oral and systemic connections, and that links all the fundamentals of wellness that we as integrative practitioners preach and preach and preach. And they're all in the book under the umbrella of managing hypertension.
And the crazy thing about this is most people, even though if you're surprised, like I have patients that have been with me a while and then all of a sudden their blood pressure is creeping up. So this does happen. And I love that you brought such a broad topic, hypertension, with which people care about, back to the oral health, which is truly your passion. And gosh, people don't want to hear that they need to get their root canal looked at and reevaluate their oral health. And we'll keep coming back to it. I'll be like, look, like this has been on your to-do list for 2 years. I need you to see a biological dentist, you know. Can off topic a little bit. What do you think about mouthwash?
Yeah. So
that
mouthwash
decreases nitrous oxide, right? And
right, exactly.
We should. The only time I recommend mouthwash is like acute COVID.
Right.
That's the only time I recommend it. But
it,
yeah,
it depends on what's in the mouthwash, right?
Yes,
so when we talk about
point.
most what people think about mouthwash, the Listerine and the chlorhexidine, even the dentist might give you. These are very short-term things. They should only be used for a couple of days at most because they do exactly what you talk about. You know, our mouth is the beginning of our gut, right? Our gut starts at our lip. And so we know that there's a microbiome associated with our gut, and there's a separate unique microbiome in our mouth. The bacteria that live on the crypts of our tongue make nitric oxide synthase. This is the rate limiting step in the production of nitric oxide. So if you annihilate those tongue bacteria with the wrong mouthwash, you don't make nitric oxide, you can raise your blood pressure 6 to 10 points with mouthwash. So we don't recommend that. There are some mouthwashes that we can use as part of a cleanup program for periodontal disease. And there's only one mouthwash that I know of that I recommend long-term for people. It's called Stella Life, and it's homeopathic. So it seems to bring the mouth into balance and support the friendly mouth bacteria and leave you with a little bit of minty breath. So.
Yeah, and it's so cool, the oral microbiome, because, you know, people that breathe through their mouths, they're disrupting that oral microbiome. And there's just so much with jaw structure, and it's so cool, and it's ignored, right? I mean, I don't think doctors, like conventional doctors, talk about this at all, right?
They don't. And this is my mission for these, you know, last couple decades of my career, is to spend teaching dentists how to partner with medical doctors like us and how to find us, and teaching dentists the medical connections that they're responsible for, because unfortunately, even most conventional dentists are not aware of these biological connections. So yes, if you're lucky in your community to have a holistic or biologic dentist or one who's trained in functional medicine, you got a gem in your hands. But they're not all in every community. So we are working on medical dental partnerships at the medical school level to bring these lectures to the schools so that young doctors, first in their training, can understand this. And always there's going to be some who become impassioned with this as a subject and become specialists in these areas. So the more that we teach and empower, these oral and systemic connections, the better our population is going to be.
Yeah, absolutely. And I think it's frustrating. I was working in the ER and I saw a patient overweight, and then she has this infected wisdom tooth. And I'm like, you have to get that pulled. This is causing inflammation in your body too. And they can't get into anyone,
I
they
know.
can't with their insurance they have. And I feel like oral health should just be such a priority, and it needs to be, because it's really a reflection of what's going on in your body. Because you don't see people with bad teeth having normal CRPs, C-reactive protein, which is an inflammation marker of the body. And if your
Right.
mouth is inflamed, your blood vessels are going to be inflamed.
Right.
So we all need to get super passionate about this. And then if you have a biological dentist near you, like, support them and just be excited. For my own curiosity, what about oil pooling, occasional versus long term?
Yeah.
What,
So
yes
there's
or
just not as much evidence about this as we'd like to see, right? We know that historically in the Ayurvedic tradition, oil pulling long term has been a strategy many people have used. Now, to be fair, they didn't have the trash mouths that we have today in the United States, right? We eat crap food as a society. We have periodontal pathogens that they historically didn't have. And I'm not sure what the role of oil pulling is when somebody has endodontal infections, endodontic and periodontal disease. Like, I don't know really, and there's not a lot of evidence on it. Certainly short term it's okay, although recognize that you never spit that oil in the sink, right?
right.
Most of us will use coconut oil. As soon as it gets down in the cold drain, it's going to solidify and you're going to need a plumber. So if
Yeah.
you oil pull, spit in the trash.
Right. I mean, you could spit it in the sink, but there will not be a good outcome.
Right.
And the other thing, if you have amalgams or mercury fillings, don't oil pull. But that's how I keep my teeth white, is I oil pull, but
Yeah.
I just like once or twice a week. But
Yeah.
my gums get good scores. So I'm like, it's the oil pull.
Yay. Yay,
Yeah.
you.
So yeah, it's a competition for me when I go to the dentist. I'm like, what are my scores? You get those 1s, 2, 3 scores and the gums. And I'm like, and I have some that are lower inside. And he said it's probably from getting braces as a kid. And I'm like, that's so annoying. So I have all my kids on Myo munchies to
Good girl.
strengthen their jaw.
Keep their
Yeah,
jaws strong.
yeah.
Yeah, I had braces too as a teenager, and I do have advice for those of you that have kids that might be of
Yes.
the age that they're
Please.
going in, and that is this. When I had braces, they pulled 4 teeth. Back then, this is what they did. They pulled 4 teeth, and I wore headgear to pull the front of my face back, closing up 15 millimeters of space in my jaw, which almost guaranteed that my tongue would be too big for my mouth.
Mm.
And fast forward later in life, as my collagen over 60 gets a little softer, my palate isn't as strong as it used to be, it pretty well guaranteed that I would develop sleep apnea later in life
Oh.
because they pulled teeth and scrunched my face too small.
Mhm.
So now I've been working with a dentist for 3 years now. I've worn several different forms of expanders to get my palate widened, and something called a Vios device that
Yes.
straightens out my teeth, right? So,
Yes.
and I lip tape and I wear my mouth guard and I don't snore anymore. My
Yay.
Oura ring tells me my oxygens are always 97 or higher.
Me too.
So without CPAP, I have been able to correct my sleep apnea. So many of my patients have been afraid to have a sleep test because they fear that the one and only treatment that I'm going to prescribe for them is a CPAP, and they know they could never do it for whatever reason. And
Right.
it's not the only treatment. There's many other options. But when your kids are getting ready to go into orthodonture, ask the orthodontist about airway and what are you doing to ensure that this treatment to give my kid a beautiful smile is also going to ensure that they have the best airway going into adulthood. And if your
Yes.
orthodontist isn't airway enlightened, keep looking
Yeah,
because
there's none around here. I think Columbus is the closest. But yeah, the Vivos, my husband and I have been looking at that for a couple of years for him. And insurance doesn't cover it. I think it's like $5,000, but they do cover it. Some insurances, if you can't tolerate a CPAP, which a lot of people get anxious with that.
Right.
So it's very
Let me tell you a
interesting.
trick about this too. I learned this recently, that insurance companies deny 35% of all first claims.
Mm-hmm.
So if you say I need a Vios, they say no. A third of the time, just because. No reason.
Right.
If you appeal it, they deny 80% of the second appeals.
Okay, it's getting better.
If you appeal it a third time, 90% are approved.
Oh, so it's that third. So the second time you're saying they deny 80.
They deny 80%. They
worse.
deny even more. They make
No,
it worse for
that's
you. They make it
crazy.
so you think there's no chance I'm ever going to get through this. But if you're persistent and you appeal a third time, more than 90% will eventually be approved.
That's a
So
great
you have to
tip.
learn how to play the insurance game
Yeah.
in order
And
to
it is
get
a game.
those
It's
things that are
purely a game.
medically necessary
Yes.
approved, because the people on the other end of the decision-making tree are not doctors. They're
Right.
statisticians and high school graduates who are following an algorithm that their insurance company has set up.
Yes. And in the previous podcast, I actually speak with a doctor about that. And he says if insurance companies, I forget if he says it's a 2 or a 5 year, but if the turnaround time for them to make money off of that decision, like the Vivo, so that's not going to help within 2 years, because it's going to extend your life like 30 years down the road, right? When you're older,
Right.
And it's going to decrease complications later in life. So that's why they're going to not approve it. Where
Right.
medications, it might keep you out of the hospital if you're on all these drugs acutely, but it's not going to help you long term. So it's
Right.
flip-flopped. And this is why we have to stop like relying on health insurance for our actual health and longevity, and just
Right.
think of it as, yeah, this is in case I get in the hospital.
Right.
It's just, it doesn't really pay for what is good. So
Yeah, two
unfortunately.
thoughts about that. Number one, if you think about it, it's really not health insurance, it's disease insurance. So
Yes.
if you split that in your brain and go, if it's for my health, I'm going to have to pay for it. If it's for my disease, then insurance might cover it. So I think that sort of helps to reframe what it is. And the second thing is, this is a Tom Blue quote: if you only did for your house or your car what your insurance covered, what would your house or your car look like? You still have to do all the routine maintenance. You still have to put the new roof on, put the new engine in sometime. That stinks when you got to pay for a new engine, but you got to do it. And so the insurance is to cover you against a catastrophic loss. And that's what our insurance is there for. Our health insurance is to protect us against a catastrophe. If we have cancer and need a round of treatment, that's what our insurance is covering. Not for wellness, not for cardiovascular prevention, not for oral health. Really, these are our expenses, and we need to budget accordingly and recognize that a lot of these things cost a pretty penny, but they are investments in our wellness.
Yeah, absolutely. And I tell people, I'm like, your car insurance doesn't pay for new tires or an oil change. So stop, especially my parents are like that. They're like, I have some functional tests I want them to get. And my dad's like, well, insurance doesn't cover that. And I'm like, yeah, but your health is more important. But let's talk about something cheap that people can do for their health that you talked about, is mouth taping at night. That is cheap. And it's so funny because sometimes at night I peel it off. So I'll like on my pajamas, on like the floor, on the covers, I'll have like these pieces of tape everywhere. It's so funny.
Yeah. So first of all, noses are for breathing, mouths are for eating. We need to breathe through our noses. Many people have become such obligate mouth breathers that their noses develop disuse atrophy. Their noses don't work. They can't breathe through their nose. If I tape their lips, they're going to feel suffocating because their nose doesn't work, or they have nasal polyps, or they have allergic rhinitis, or for whatever reason, nasal obstruction. Those people cannot jump into mouth taping right away. They need to ease into it. We need to work on opening those nasal passages. Sometimes that's consultation with the ears, nose, and throat surgeon. Sometimes that's food sensitivity tests to reduce allergic or inflammatory responses in their nasal passages. We do sublingual immunotherapy drops. Instead of allergy shots, you do allergy drops. Desensitize them to the mold and the pollen and the dust. Atlanta lives under a mold cloud. Every single day, our mold spore counts are off the chart high, no matter whether it's spring, winter, fall, summer. So we have lots and lots of mold allergic and mold sensitive patients. So we do sublingual desensitization, and they're shocked how much their nasal passages open up when they don't have a chronic daily immune reaction. So then some people have very soft nasal cartilage. So when they go to sleep at night, their noses collapse. Those people can get by with a little nasal splint. One brand is called Mute. They look like little plastic hair ties, little tiny itty bitty things that go up inside your nose to hold your nasal passages open so that you can breathe through the night through your nose. Then we start with lip taping. So there's lots of different things you can buy online, lots of resources. I use 3M micropore paper tape, and I use a 2-inch roll. I cut off about a 3/4 strip. I fold the corners back ever so lightly. Start by taping it right below my nasal ala in my girl mustache. That's where I put it, right there. And then slightly pull it taut, close my lips sealed, and I leave the corners of my lip opened. Some people choose to tape horizontally. I like a vertical tape. I like a vertical tape because if I cough or sneeze in the middle of the night, I can expel air out the side. If my mouth gets dry, I can stick a straw in that little hole and take a little sip without having to take off my tape. And I tend to be a pretty robust maker of saliva. I kind of drool a little bit at night, and that way I don't snort on my own saliva. I can drool out the side just like always. So I like a horizontal lip tape. But at first, the first night or two, I found myself ripping it off. I couldn't tolerate it. Now I sleep all 8 hours lip taped, and I love it. I don't want to travel without my tape. I sleep better without my tape. My Oura ring says my oxygen's better with my tape. So I love my lip tape.
It's addicting once you start doing it. Yes, I travel with mine too, and it's so great. I also do the vertical, and I can talk with it when I tape it too, because I can talk out the sides of my mouth. So it's nice. I agree with you.
It's not all that romantic, but if you get the romance first, you can tape later.
Yeah, I mean, that's what we do. We do romance, and then I get all my biohacks ready at night, and I'm like, okay, I'm putting my mouth tape on. Let's go. But yeah, it's fine. I have my frownies on, my mouth tape, my mouth guard. I look so cute at night. So since we're talking about sleep a little bit, it's often overlooked when discussing blood pressure, and especially if people are going to their regular doctor, they don't bring that up. So could you share some insights from your new book about how sleep affects blood pressure and what alternatives, for sleep apnea? I know we spoke about a little bit about that, but why, that helps lower blood pressure.
Well, one thing that I think is, for me, was enlightening to me was I do a fair amount of 4-point cortisol tests. Looking at adrenals, right? So we're looking at, can your adrenals make enough cortisol to meet your physiologic needs? So we look morning, noon, afternoon, evening. You have to pee on a test strip or spit in a test tube 4 times a day. And if your morning cortisol is nailed to the ceiling and off the chart high in the morning and normal the rest of the day, the question is, what are you fighting? What grizzly bear are you fighting throughout the middle of the night that you wake up with this high cortisol? And very often the answer is undiagnosed sleep apnea. So for me, whenever I see a high morning cortisol and 4-point cortisol test, that patient automatically gets a sleep test. Now, when we look at the sleep test results, most doctors are pretty well trained in addressing the AHI, the apnea hypopnea index, which if it's above 5, they have mild sleep apnea, 5 to 15. But there's another number on that sleep test called the RDI, the Respiratory Distress Index. Younger and thinner people will often have a mismatch of their AHI and their RDI, where their RDI is well above 5, but their AHI is not. And many times the sleep specialist, in my opinion, will underdiagnose their sleep apnea. And they have a condition called upper airway distress syndrome, UARDS. Upper airway distress syndrome is a subset of sleep apnea. It's present in all the sleep apnea literature. And for the same amount of distress, like let's say the number is 8, a person with a sleep apnea, AHI of 8, may only be a little bit symptomatic. A person with an RDI of 8 is often wildly symptomatic with symptoms that you wouldn't think about unless you pay attention. Anxiety, OCD, panic attacks in the middle of the night, nightmares. Why would they be panicking in the middle of the night? Because their oxygen levels have dropped, because their brains aren't getting rest, because they're in this high state of cortisol. And so upper airway distress syndrome is underdiagnosed and undertreated. And those people deserve a trial of sleep apnea treatment, just like the people with full-blown sleep apnea. And so how do we treat them? Sometimes sleep CPAP masks or BiPAP masks. Those are not the sexiest things in the world. You talk about, killing the romance, getting out that CPAP machine and put it on the elephant trunk is not particularly sexy. So we try dental appliances. We try mouth guards. We try, there's some surgeries that can be done. I'll talk about those last. There's something called an Inspire device, which is like a pacemaker for your diaphragm. So every time you're supposed to be breathing and aren't, it pulls your diaphragm down, sucks in some air for you, and ensures that you can get some deep restorative sleep with good flow of oxygen through your lungs. There are 2 surgeries. Well, there's 3 surgeries that are often done. One is a tonsillectomy. For many people, the airway blockage happens at their tonsils. And if they have chronic micro abscesses in their tonsils or tonsil stones, sometimes that's where the obstruction is. So a simple tonsillectomy, which is never fun as an adult, but if necessary, can cure sleep apnea. So tonsillectomy is one. The second is a hyoid advancement. They take that hyoid bone in your neck and pull it forward, and that pulls your tongue back out of the back of the floor of the back of your palate and get your tongue forward. And the third one is really drastic and really scary, but I'm going to introduce your audience to it because it has over 95% cure of sleep apnea with no CPAP required. And that surgery is called MMA, maxillomandibular advancement surgery. So they go inside your face, underneath your lips. They cut your jawbone, your cheekbones in half. They cut your jawbone in half. They pull that front part of your face forward 5, 10, 15, 18, 24 millimeters, whatever it takes, because they have all this CD, 3D, AI machinery to help tell them what it's going to take to get your face balanced front to back, side to side, and get your tongue moved forward out of your airway. So MMA surgery done by a maxillofacial surgeon has about a 90% CPAP cure rate.
Ooh, wow. But I mean, couldn't some of that stuff be fixed with like physical therapy and those kind of specialists?
Yeah, so there is also a type of physical therapist, a type of therapist called a OMT, oromyofunctional therapy. And it's kind of like physical therapy for the jaw, lips, and tongue. So we do exercises like and put the tongue up on as close to the tip of your nose as you can, and put a string with a weight, and then chew the string up into your mouth to try to strengthen all those muscles. And yes, sometimes OMT can cure a sleep apnea case. And sometimes our functional medicine tricks and tips to lower inflammatory burden, because sometimes the tongue is too big for the mouth because it's swollen, because the patient's eating gluten that they're severely sensitive to and had no idea. So sometimes our functional medicine tricks can work, but when all those fail and the patient is still suffering, there's a graded level of other things that are available besides sleep CPAP.
Right. And no one should suffer from poor sleep,
Right. And if you do not get 7 to 8 hours of sleep, it's almost guaranteed your blood pressure will not be under good control.
Right. Right. And so now let's talk about the connection between oral health and cardiovascular health. And because it's really intriguing, can you explain some of the surprising links that you discuss in your book and
Yeah,
offer practical advice for those to maintain good oral health to
yeah,
prevent heart-related
absolutely.
issues?
So, like in my patient Dee's case, it was a dental abscess that resulted in her demise eventually. And so I have since been very, very aggressive at looking for blood biomarkers that tell me that the patient's at risk for cardiovascular disease. But after a lot of digging and studying, I learned that those same biomarkers predict dental disease.
Mm.
So I'll share with you what those patterns are because they're super helpful. And as a result, I can't tell you, I think we've had 10 patients referred for dental extractions this year that
Mm.
that had no symptoms except on their blood work. So
Wow.
I knew that their blood vessels were at risk and they were facing a potential heart attack or stroke if we didn't get these
Mm.
sources of inflammation under control. Remember that a root canal tooth has had the blood supply and nerve removed, so it has no feeling. So it can smolder an abscess with no symptoms to the patient in their mouth, but those symptoms might be in their brain, in their heart, in their blood vessels, in their kidneys, in their genitals, anywhere else in their body, right?
So
So
scary. Yeah.
it's pretty scary to think about that. And we swallow 2 liters of saliva every day. So
Ooh.
imagine all those mouth bacteria are ending up in our gut. So
Yeah.
there's crosstalk. The mouth talks to the gut bacteria talk to the mouth. They talk back and forth to each other. If you don't have a healthy oral microbiome, it's very hard to have a healthy gut microbiome. And if you don't have a healthy gut microbiome, it's really hard to get your oral microbiome healthy. So we got to work together. So most of us who study cardiovascular medicine have understood that cholesterol is really not a problem unless it gets corrupted. If the
Mm.
cholesterol gets corrupted because it's sugar coated or it's oxidized or it's the wrong shape or size, now it's a bad actor, just like teenagers, right? Well-behaved teenagers are welcome at my house.
Ah,
Corrupted teenagers got no business near my kids.
yes.
Cholesterol is the same
Love
way.
it.
Only when it's corrupted is it a problem.
Mhm.
So we look for corrupted cholesterol and we look for markers of inflammation because really cardiovascular vessel disease is inflammation. So there's
Mm.
a couple of markers we look at specifically in what we call the FIRE panel. One of them is LPPLA2, and that stands for lipoprotein associated phospholipase A2. Lipoprotein A2 is an enzyme that's made by white blood vessels. And specifically white blood vessels that live inside the plaque of your arteries. And when that number is elevated, tells me you have a volcano that's rumbling inside your arteries. And it could go anytime, it might blow, but it turns out that LPPLA2 is also elevated in the gingiva of periodontal disease.
Mm.
So if I measure a C-reactive protein and says the patient has inflammation, and their LPPLA2 is elevated, they get an immediate referral to the dentist for hidden periodontal disease. And I
Mm.
want them to come back with all those pocket numbers and tell me, where's the bad tooth? You got a bad one in there somewhere. And I ask the question, is there pink in the sink? Do you have blood when you brush or floss? And almost always, when LPPLA2 is elevated, the answer is yes.
Mm.
Now, that patient with gum disease is putting their blood vessels at risk, putting their heart at risk, they're putting their brain at risk because
Mm.
their gums are inflamed.
Yeah.
So that's one. The second one is another marker called myeloperoxidase, MPO for short. That's an enzyme that's made when the plaque volcano rumble actually ruptures into the bloodstream. Body
Mm.
doesn't like it, starts to make a clot over the top of that cholesterol leak, and myeloperoxidase is oozed into the bloodstream. So that tells me that this patient has the most advanced of vessel disease and is really fixing to have a major event if we don't get it under control. So to me, this is a high risk cardiovascular patient that I want to correct every possible risk factor.
Yeah.
But guess what? In the dental literature, we have discovered that myeloperoxidase is also found at the apex of a tooth root when there's an abscess.
Mm.
So when I see an elevated C-reactive protein plus an elevated myeloperoxidase, that's another immediate referral to the dentist for a cone beam CAT scan and a very, very careful evaluation of their tooth roots, wherever there's a root canal, wherever a tooth has been worked on in the past, it has a crown or a filling, or even, this is a funny place, where the wisdom teeth have been extracted. Sometimes there's an infection in the bone called a cavitation that's left over from where the wisdom teeth used to be and aren't anymore. So there's not even a tooth there, but there's still infection and it can still cause abnormal blood markers. This is harder to identify and harder to treat, and you need a really aggressive dentist who's willing to work with you and use your high level of suspicion, especially based on these blood markers, to look for these cavitational lesions. And but they can be hugely symptomatic because lipopolysaccharide, LPS for short, and my nickname I borrowed from Lindsay Berkson is little pieces of shit, because lipopolysaccharide comes from gram-negative bacteria. These are the same types of bacteria that we find in stool. We find them in our mouth, and we find them in these cavitation lesions, along with Lyme disease bacteria, along with spirochetes and amoebas and all kinds of nasty things will live in these infections, and they get in your bloodstream and all bets are off for your vascular health.
Yeah, so it's all connected. And that's why I'm so excited for this book that you have coming out. And the launch date when they can purchase it is
November 14th on Amazon. Okay. The Blood Pressure Blueprint, Dr. Elle Campbell.
Yeah. And how else can everyone out there reach you? So we're all going to get the book, because even if you don't suffer with blood pressure, your spouse, your family member, your friends, they do. So you can really help them help their health through this book. So Amazon, and then where can everyone else find you if they want to look you up on social media?
My website, bpblueprint.com, will be the book's website.
Awesome. Awesome. Well, thank you so much, Dr. Campbell. I've been wanting to talk to you. I feel like we need to do another podcast in a couple months or something to talk.
Absolutely. Happy to chat. We'll talk about brick and mortar, why it's so important to have a face-to-face relationship with your patient.
Yes, absolutely. Well, thank you so much for all the good work you're doing also.
You as well, darling.
Thank you.
You're welcome.